Do you suffer neck pain and upper back pain like many of us do? If you answered yes to this question, stay tuned because in this video, we're going to teach you 3 of the very best exercises to stop chronic neck pain. All right, everyone, buckle up. Let's get into the video and take a look. Welcome to Physio Tips with Marrow. I'm your host, Marrow Burnett. And for those of you that don't know me, I'm a board certified specialist in orthopedic physical therapy and the owner of Australian Physiotherapy Specialists Physical Therapy Center located in Jacksonville, Florida here in the USA. I've been practicing physical therapy for 20 years and have been a continuing education instructor of physical therapy for 14 years. And today I get the pleasure to share with you, the audience, some great information related to cervical instability. Okay, we're going to give you 3 specific exercises to help bring you some relief if you suffer cervical instability. But before we get into the exercises, let's take a minute and define out what cervical instability is. And then step 2, we're going to give you some key signs and symptoms so you can decide whether or not you may be a sufferer of cervical instability. And then finally, step 3, we're going to give you 3 simple, easy to do exercises to immediately start getting some relief. Okay, guys, let's get into step number 1, defining cervical instability. Stability is required by the muscles of the cervical spine as well as the muscles of the shoulder girdle to be able to hold the head up against gravity and to allow the upper extremities or arms to function properly. When you've had neck pain or injury, what happens as a side effect of your pain and discomfort is it weakens these deep stabilizing muscles. Once that occurs, the bones of the cervical spine start to move beyond their normal anatomical range. They become excessively mobile. That would be defined as cervical instability. Cervical instability often can occur with ligamentous damage. Maybe you've had a whiplash injury and your ligaments have been torn or stretched. That would allow segments of the cervical spine to move excessively, and that would be defined as instability. Other instabilities could be mechanical in nature, a crack in the vertebra, where the vertebra begin to move too much. An example is a diagnosis called spondylolisthesis, where you have a crack in the legs of the vertebra and one vertebra translates forward relative to the other. When you have cervical instability, if it's in the upper neck, typically you might get headaches, dizziness, or nausea. If you have instability in the middle to lower neck, you might get arm pain, tingling numbness, pain in the upper back or trapezius muscles. So that's a good working definition of cervical instability. When thinking about signs and symptoms of cervical instability, there's a few things that often pop up. The first thing is that your head may feel heavy for your neck. It feels better to offload, maybe to recline back or lay your head back on a headrest, maybe a recliner, maybe lying down is the thing that makes you feel better. In that scenario, that would be a sign of cervical instability. Another sign is that your neck's just easily provoked. Tasks that shouldn't bother your neck suddenly do provoke your neck. For example, you're doing something in the yard or maybe you're exercising in a really mild way and suddenly your neck flares up for 2 days. That's a classic sign of instability. You may get frequent popping or cracking or grinding in the neck. That's another sign that your neck may be unstable. And finally, your neck doesn't like static postures. If you sit in one place or stand in one place for too long, it starts to become bothersome. But if you get up and move around a little bit, it feels better. Those are some classic signs and symptoms of cervical instability. This exercise is called the occiput lift. It's a postural exercise that'll help you recruit the deep stabilizing muscles of the neck as well as the lower back. Studies have shown on folks that suffer chronic neck pain that muscles very important for stabilization of the spine will become inhibited. A couple such muscles are the muscles in the front of the neck, 2 deep muscles that attach to your vertebra called the longus capitis and longus colli. This exercise was shown in a 2007 study by Deborah Falla to turn on those muscles and recruit them. So as your deep muscles switch back on, your pain starts to switch off. I'm going to show you how to do this exercise from a side angle. The first part of doing the occiput lift is I want to make sure that my low back is in a neutral pelvic position. If we think about our butt bones that we sit on, called ischial tuberosities, if I rock back all the way on my butt bones, that's one extreme. And then if I rock all the way forward off of my ischial tuberosities, that's the other. And then I come back at a nice halfway point. From this position, I want to think about my neck position now. What I want to avoid is having my upper neck slightly extended. So I'm going to very gently lift the back of my head while bringing my chin down to a neutral position. Once I do this, I eliminate that extended upper cervical position. This position is shown to activate the deep stabilizing muscles in the front of my neck, as well as the deep muscles in my lower back. A great exercise at the office could be you get in this position, you hold it for 10 seconds, and then relax. And maybe you repeat this every 15 minutes during your workday. Also, you could do this in the standing position, formally, get into that perfect position, hold it for 10 seconds, maybe do 5 or 10 reps, and you could do that formally 2 times a day to help recruit the deep stabilizing muscles of the neck. So this is the occiput lift. Now let's take a look at exercise number 2, the waiter's bow. We're going to show you this upper shoulder viewpoint of this exercise. So I find my low back neutral. We practiced that earlier. Too far one extreme, too far the other, and then I come back to the middle position. I make sure my chin is in a good position so that I'm not into cervical extension. Bring it gently to level, shoulders relaxed, and then I'm going to let my eyes look downward about 45 degrees, and I'm going to do maybe a 15 or 20 degree tilt, hold it for 5 seconds, and then slowly return back to neutral. Got my chin in the perfect position, my pelvis is in the perfect position. Small tilt, hold it for 5 seconds, and then slowly back. It's very important that this is pain-free. It's also important that when I tilt forward, I don't lose my lumbar lordosis. I have to keep that curve. One trick, sometimes you can put your hand in the front, and as you tilt, make sure that you don't feel your stomach come together. If you did this and you felt your stomach squished together, then you know you've lost your curve. So maybe like your thumb and your first finger in this spot, small little tilt, and that's a great way to help. And that is the waiter's bow. Fantastic for strengthening the posterior muscles of the neck that stabilize. Let's look at this at one more angle, focusing on the hips. So here, I'm too far flexed. Here, I'm too far hyperextended. Here, I'm right in the middle. Now, my hands are on my lap. My chin is in a nice neutral position. I'm going to do a small trunk lean, maybe 10 or 15 degrees. Hold it for 5 seconds, and slowly return. To do it poorly looks like this. You start to lean forward, you lose your low back curve, and you round at the back. Another way to do this poorly would you slide forward and then you hyperextend the back. That might indicate that you have poor control of the muscles of your lower back. So you would try to find the neutral position again, start with a very small angle, maybe just 5 degrees. As you get better with this, you progress to maybe 10 or 15 degree angle. Great exercise for strengthening the posterior of the neck. Let's talk about our final exercise. This is an exercise for your middle and lower trapezius muscles, or your shoulder blade muscles between your shoulder blades. Frequently what happens in neck pain and cervical instability is you might start to develop some muscle imbalances. Muscles like the upper trapezius would become excessively tight and overactive, and you might find that one shoulder is higher than the other. You may also find that your shoulders are protracted and kind of bent forward, and that puts strain on your neck. So we want to address the middle and lower trapezius muscles between your shoulder blades. One easy exercise that you can do is find the neutral position that we worked on earlier with the pelvis, hands on your lap, relax your shoulder blades down, and then slowly bring your shoulder blades back just a centimeter or so, just to feel your shoulder blades come against your chest wall. Relax your shoulders. Step 2, gently bring them back just a couple millimeters, maybe a centimeter. Hold it against your chest wall. Relax the shoulder blades down. Hold that for maybe 10 seconds. And that's a great way to activate those middle and lower trapezius muscles. And then relax. You could work up to where you're doing a set of 10 of these and easily practice this 2 or 3 times during the day. A great exercise to help fight that muscle imbalance where one shoulder is higher than the other. Let's show you this exercise from another angle. Let's look at one more angle for the scapular retraction in seated. In this scenario, my shoulders are a little high, a little forward. I'm going to relax the shoulder blades down. I'm going to slowly bring my shoulder blades back and down a centimeter so that they become flush to my chest wall. My neck is in a neutral posture. Same with my lower back we practiced earlier. Recruit your middle and lower trap muscles. Hold it for 10 seconds and then relax. You could repeat this until you can build up to maybe 10 or 12 reps. This can be done formally twice a day. It's a wonderful exercise to relax your upper traps and decrease tension from your neck. All right, that's the seated scapular retraction. Slightly down, slightly back a centimeter. Hold it in those imaginary back pockets, and then relax. Let's look at this middle and lower trapezius exercise one more time. We find our neutral position, too far flexed, too far extended, right in the middle. Now, let's say my right shoulder blade's too high. I relax my shoulder blades down, slowly bring my shoulder blades back and down a centimeter, relax the upper traps, looking straight ahead, hold it for 10 seconds, and then relax. Okay, find my neutral position, my occiput's in a good position, relax my shoulder blades down, gently come back a centimeter, relax them kind of down and back. Some people will say, imagine there's a back pocket right here and you're moving your shoulder blades down and slightly back into that back pocket. You don't want to overdo it, especially if you have neural tension in your arm. Too much pulling it back and down could cause your hands to get tingly. In that case, try smaller forces. Slowly relax, barely back just a little bit. Feel it come against your chest wall. Shoulders relax, upper traps relax. 10-second hold. And there you go. There's a nice couple exercises you could do. Easy to perform. You could do them at your office. You could do them every day. Well, thanks for watching. 3 tips to help chronic neck pain. I hope you got something out of it. If you did, do us a big favor. Hit that like button below. Don't forget to share it with a friend. And remember, you can subscribe to our channel to receive more videos like this on helpful physiotherapy-related tips. Thanks again for watching. It's goodbye for now, and we'll see you next time on Physio Tips with Marrow.